What if I told you there was a treatment that could help improve your sex life, prevent recurrent UTIs, and even help your urinary symptoms? Well, I'm Dr. Rena Malik, your urologist and pelvic surgeon, and today I'm going to let you in on a secret that everyone should know about. We are so close to 1 million subscribers. Thank you so much to each and every one of you who've subscribed so far. Please share this channel with your friends, have them subscribe so that we can get to that 1 million mark. I would really appreciate it. So this magical treatment is actually for postmenopausal women. But before you click away, each and every single one of you knows someone in this category. A mother, a wife, a sister, a partner, or a friend. I guarantee you that these women will love you if you share this information with them. So stick around, learn about it, and share this video with them so that they can help themselves too. So before we get into this magical treatment, I need to explain what happens to the vagina after you lose estrogen during menopause. So prior to menopause, we have lots and lots of circulating estrogen, and they help with three main things. Number one is thickness and elasticity. They increase the collagen content of the vagina to help it be soft and pliable. Number two, they help with moisture. It helps maintain things like mucopolysaccharides and hyaluronic acid, which helps the vagina have moisture. And lastly, it helps with maintaining good blood flow. But even more than that, the vagina produces something called glycogen when estrogen is around. And lactobacilli, which are good bacteria in the vagina, use this glycogen to produce lactic acid. This keeps the vagina in acidic pH between 3.5 and 5. And this helps maintain normal vaginal flora and protects women from recurrent urinary tract infections and vaginal infections. This is why so many women start getting recurrent UTIs right about the time when they're perimenopausal or about to go through menopause. Once you go through menopause, the normal circulating estrogen declines 95% to a level of 5 picograms per milliliter, when a normal premenopausal woman has anywhere between 50 to 350 picograms per milliliter, depending on the stage of menstruation their body is in. So once you lose that estrogen, what happens? Well, the vaginal epithelium, or the skin of the vagina, thins. It loses elasticity. The vaginal canal itself shortens and narrows, and your secretions decrease by almost half. And lastly, the vaginal pH increases to above 5, so you lose that lactic acid, which helps prevent those bad infections. Outside of menopause, there are other states that women can have decreased estrogen. One is if they've had their ovaries removed surgically. Number two is if their ovaries are not functioning correctly, or potentially if they've had radiation or chemotherapy that can affect the function of the ovary. Number three is if they're taking medications that can have anti-estrogenic effects, like those that are for breast cancer, like tamoxifen. Also, interestingly, women who are lactating just after having a baby postpartum can have decreased estrogen states. And lastly, if you have disorders of the hypothalamus or the pituitary or other conditions like lupus that can affect that, you can potentially affect your estrogen production. So what symptoms are you really going to have? Well, you could have vaginal dryness, decreased lubrication, decreased arousal, orgasm, or sexual desire. You can have pain with intercourse, as well as malodorous vaginal discharge. You can even have vaginal bleeding due to the friction from sex when you have really thinned out vaginal epithelium. And lastly, you can have urinary symptoms like urinary frequency, pain with urination, discomfort and burning, and recurrent urinary tract infections. And you know the kicker is that 70% of women with these problems don't even talk to their healthcare provider about it because they think it's just normal and they have to live with it. Well, guess what? There are treatments that help. So what can you do? Well, first off, you can try things called vaginal moisturizers. They can certainly help with the dryness and discomfort and potentially with any of the symptoms that are associated with that dryness and discomfort. But it hasn't been shown to help prevent recurrent bladder infections. Lubricants are a great option, particularly if you're having pain with intercourse. I've made a whole video about lubricants, but typically I recommend if you're not sensitive to silicones or oil-based lubricants, those are a little bit better because they last a little bit longer, whereas the water-based lubricants need to be reapplied because they do dry up pretty quickly. If you have symptoms despite trying all these things, another option is vaginal estrogen. And a lot of people get freaked out when I talk about vaginal estrogen, but estrogen works great. And using vaginal estrogen doesn't increase the amount of estrogen in your body to a significant amount. It increases it only slightly, very minimally increased compared to premenopausal levels. There's actually never been a reported case of breast cancer, blood clot, or any other problematic disease process due to the vaginal form of estrogen. This is different from taking a pill by mouth, but putting it in the vagina will actually help with all of these symptoms, specifically recurrent urinary tract infections and even urinary symptoms like urgency and frequency. They're super easy. They come in multiple different formulations, including a cream, a suppository or tablet that you can put in the vagina, or a ring that your healthcare provider can place and you can have changed once every 3 months. There are some minimal side effects. Sometimes people get vaginal discharge, breast tenderness, or vaginal bleeding. However, I prescribe this on a regular basis, and I can only remember one patient in the last 3 years that's had any issues with the vaginal estrogen. After you start it, it takes about 6 weeks to see the full effect, so stick with it. The only real contraindication is patients who are actively being treated for breast cancer. If you've had a history of breast cancer, talk to your oncologist because this may still be an option for you. However, if you're completely averse to estrogen treatment, there are other options available. There is vaginal DHEA as well as ospemifene, which is an oral medication, and lastly, off-label testosterone. If you want to learn more about those, comment down below. I'll make a video about them, but make sure you talk to your healthcare provider if you're suffering with any of these symptoms. As always, remember to take care of yourself because you're worth it.